Welcome back. The real price of health care. Due to rising costs, some families are foregoing medical care just to save a few or a few $1,000s. A new report from Bankrate found that 1 in 4 families do not seek medical attention because of financial worries. Joining us right now to talk more about that is the president and founder of Preventive Medicine Research Institute, Dr. Dean Ornish. Dr. Ornish, good to see you.
Good to see you,
Thanks
Maria.
so much for joining us. What's your solution for cutting this skyrocketing cost of health care?
That's a good question. You know, all of our work is based on a very simple idea, which is to say, what's the cause? And it turns out that 86% of the $3.2 trillion we spent last year on health care are for chronic diseases that are largely not only preventable, but even reversible by changing diet and lifestyle. And so for the last 40 years, my colleagues and I have done studies showing that simple lifestyle changes, eat well, a whole foods plant-based diet, move more, exercise, stress less, like meditation, and love more, family ties, community, and so on, can not only prevent but even reverse the most common chronic diseases. We found that it can reverse heart disease, diabetes, prostate cancer in its early stages. When you change your lifestyle, it changes your genes. It turns on the good genes, turns off the bad genes, and even can actually lengthen telomeres, the ends of our chromosomes, helping us to reverse aging at a cellular level.
It's incredible. I mean, we know all this stuff and we just don't do it.
Well, it turns out that 5% of the people account for up to 80% of healthcare costs, and those are the people that we work with. And so people think it has to be a new drug, a new laser, something really high-tech and expensive. And so we partnered with a company called ShareCare, where now Medicare is covering our program, many of the insurance companies are. So we're creating a new paradigm of healthcare rather than sick care by showing that people can not only prevent but even reverse the most common chronic diseases. And not only is it good for you, but it actually saves money. Highmark Blue Cross Blue Shield found they cut their overall healthcare costs in half in the first year, and Mutual of Omaha found they saved almost $30,000 per patient in the first year. So if we really want to make healthcare affordable and available to most people, we need to really get to the cause of why most people get sick, which to a large degree are the lifestyle choices we make.
Well, Dr. Dean, I'm living proof of that, because I had a lifelong chronic GI problem that was incredibly painful. And the instances of it, rather than going on some drug that might give me a heart defect or have horrible side effects, I became a vegetarian about 6 years ago, and more recently started eating vegan, and it changed my life because literally my problem went away just with the change in diet. And there's like a lightness. And working this early morning shift for so many years, luckily I didn't gain a lot of weight too.
Well, your body digests the food so much easier when it's clean vegetables, right?
Right, and I love to eat. I eat a ton of food, but I feel fantastic. I can gorge and still feel okay.
And that's what we find is people have more energy, they think more clearly, their sexual function often improves, they don't need as much sleep. And so that's what enables people to sustain this. You know, people think, oh, I can get my doctors think I can get my patients to take a cholesterol-lowering drug, but there's no way they're going to change their lifestyle. And yet most people are not taking their drugs, and we're getting 85 to 90% adherence to our lifestyle program. But it's not fear of dying that's sustainable, it's joy of living, that what you gain is so much more than what you give up, and that sounds like what you're finding too.
Yeah. So you said that that a lot of the insurance companies are picking up your program. Are you seeing corporations jump on and want to implement that to their employees to help cut their costs?
Yeah, again, because 5% of people account for 80% of the costs. Most large corporations are self-insured, and so those savings accrue directly to their bottom line.
That is terrific.
But in terms of eating well, I guess speaking for the non-vegans in the crowd.
Well, you don't have to be a vegan. You can be a vegetarian.
Okay, or non-vegetarians in the crowd. Isn't fatty meat less dangerous than we used to think, given the recent medical literature?
Not really, and it's not all or nothing. We found that to the degree you make these changes, there's a corresponding benefit. The more you change, the better you feel. The better you feel, the more you want to keep doing it. And the more you change, the more diseases we look at and the more underlying biological mechanisms we study, the more reasons we have to explain why these things are worth doing. So it's not all or nothing. I wrote a book called The Spectrum that was based on the finding that the more you change, the more you improve. And so if you're trying to reverse a life-threatening illness, that's the pound of cure. You have to be pretty strict.
Nina Teicholz has written a book saying the war on fat was misguided.
Yeah, well, I think Nina's misguided. The nice thing about research, why I spent 40 years doing research published in all the leading journals, which unfortunately she hasn't, is that it helps people sort out what's true and what isn't. And what's true is that to the degree you move towards a plant-based diet, you're going to be a lot healthier.
Well, I mean, she's a journalist, but she's citing peer-reviewed medical studies, right?
Well, you know, they say even devils can quote scriptures, right?
Wow. Wow. Well, so, yeah, the plant-based diet. I mean,
we need to set up a debate.
Yeah, we got to have a debate on this.
Yeah.
But let me ask you, because the mapping of the genome was real helpful here, right? Because we figured out that, you know, eating poorly causes heart disease and diabetes, and
yes.
smoking causes cancer. Do we know anything more about the brain in terms of autism and Alzheimer's as a result of that mapping of the genome 20 years ago?
Yeah, mapping the genome is important. Let me say two things. One is that there's a lot of information coming out that these same lifestyle changes, it wasn't like we had one lifestyle program for reversing heart disease, another one for diabetes, another one for prostate cancer. We actually are about to do the first study showing we can reverse Alzheimer's disease using these same kinds of approaches.
Really?
We think anyway. The evidence seems to indicate that that's true. Now, what's interesting is that with all this talk about personalization, if you're talking about developing a new drug to target a particular pancreatic cell line, that's great. That's personalized. But for most people, it's the same diet and lifestyle program, eat well, move more, stress less, love more, that can not only prevent but even reverse many of the most common chronic diseases. And as you're indicating, the only side effects are good ones.
All right, plant-based diet, James Freeman.
Well, we'll see.
Some people say you need the iron of meat sometimes, and you could do everything in moderation, but you're not buying it, Dean Ornish. You say plant-based all the way.
I grew up in Texas eating meat all the time, but you know, I felt so much better when I changed. That's why I'm doing it.
All right, Dr. Dean Ornish, great to see you.
It's great to see you.
Thanks so much for joining us this